Hi, Year 6. Today we're going to learn about a new topic. We're going to learn about what are drugs and medicinal drugs. So it's actually two topics. First one is what are drugs, and the second one is medicinal drugs. So we're going to, this is in page 70 to 75 of your textbook. So your LO and STS, your lesson objective, is to explain what drugs are and their effects, match the illness to the correct medicine to be taken, and explain the scenarios about medicinal drugs. Your steps to success will be are to learn what are medicinal and harmful drugs and learn how medicinal drugs are used. So first, let's talk about what are drugs. So drugs are chemicals that change the way the body works. So drugs ani ia mengubah badan kami dari dalam. At kadang-kadang dari luar lah, tapi macam fungsi badan kami itu terubah because of these drugs. So drugs bukan semestinya indah baik. Medicinal drugs are drugs that help your body. But harmful drugs are drugs that damage your health and affect the way you think and act. So the one over here are medicinal, the ones over here are harmful. So harmful drugs can be addictive. Addictive ani, it means that once you start taking the drug, it is very difficult to stop. So once you take the drug ito, your body somehow wants it more. Yata artinya addictive to. Sama ada kamu mau, inda mau, macam badan kamu tu cakap aku mau lagi. Tapi padahal utak kamu inda semestinya cakap kamu mau tu. Okay, so drugs, as I said, are split into two. Medicinal drugs, not necessarily good drugs lah, but drugs that have useful effects to humans, berguna kepada manusia, if digunakan secara betul. And harmful drugs, ani sikit atau banyak pun masih jua indah baik untuk kami. So, examples of harmful drugs are methamphetamine, cannabis, tobacco, and alcohol. So alcohol itu pun a drug tu. So these are harmful drugs. Indah baik untuk badan kami. So let's talk about medicinal drugs. Sometimes medicinal drugs are given to you by a doctor to help you feel better or get well sooner. So they can help your body in different ways, such as relieving your pain supaya indah sakit, relieve discomfort supaya indah rasa lain rasa badan atu, kadang-kadang macam badan atu lamah, sometimes the drugs pun remove that feeling, and cure diseases. So sometimes you need drugs to fight the disease. So for example, we have, this is an example of a medicinal drug, painkiller. So efeknya ya pain, ya kill the pain. So ya membunuh pain atu. So painkillers are medicinal drugs that help relieve pain, such as a headache or injury. Common painkillers include paracetamol and aspirin. If you're curious, Panadol is actually a paracetamol. Cough syrup. Medicine that can help you stop coughing when you have the common cold or the flu. So cough syrup, ya ada cough dalam ia punya nama, so it helps you stop coughing. Antibiotics. Some illnesses such as tuberculosis, typhoid fever, and certain infections are caused by bacteria. So bacteria ani kadang-kadang buat kami sakit. If someone has an illness but caused by a bacteria, the doctor will often give them antibiotics. So, if doktor itu sangka kamu punya penyakit itu disebabkan oleh bakteria, ya bagi antibiotics. Antibiotics are medicinal drugs that kill bacteria and stop them from growing. So, anyang penting. Antibiotics do not work against viruses. So, yang di atas atu bakteria, ubat atu mau. Tapi ani virus. Antibiotik ani pun kan cuba lawan, senyum ya saja. Pasal ya tahu indah akan berfungsi. It doesn't work. So, antibiotics ani is important because it must be prescribed by a doctor. Mesti dibagi oleh doktor. The right antibiotic must be prescribed to kill the bacteria causing the illness. Antibiotik ini banyak-banyak jenisnya. Untuk tahu mana yang betul, doktor itu mesti bagi antibiotik yang betul. It is important to follow the instructions on how the antibiotics are to be taken correctly and to finish the antibiotics given. So, sekiranya doktor beritahu, minum 2 kali sehari. Jangan kamu minum 10 kali sehari. Doesn't mean you eat a lot, that means you get well faster. It doesn't work like that. Also, if sekiranya doktor itu bagi cukup untuk 5 hari, hari kedua kamu berhenti makan ubat, it doesn't work like that. Kadang-kadang, because if you do not follow the instructions, the bacteria may become resistant to the antibiotics. And if you have the same illness again, the antibiotics will not work. To bacteria, aku tahu sudah apa nih. So, block the antibiotics. Indah mau lagi arah the bacteria itu. So, other medicinal drugs include throat lozenges. So, they treat your irritated throat. Kadang-kadang if terlalu banyak berbatuk atau terlalu banyak batuk, sakit rasa leher, these will help you. Creams can be used to treat skin problems like eczema, ringworm, or athlete's foot. So, cream usually used on the skin. Eye or ear drops can be used to treat problems with eyes or the ears. So, mata untuk ear, eye untuk eye, ear untuk ear. And nasal sprays can help clear a blocked nose. So, nasal for nose. Okay, time for your work. Please complete activity 20, which is page 56 to 59 of your workbook. Good luck, you 6.